All right, so some medications that can cause diarrhea. First on my list are antibiotics like amoxicillin, augmentin, macrolides like clarithromycin and azithromycin, and then some cephalosporins like ceftonir. It's important to note that if you take a lot of broad-spectrum antibiotics, it can put you at risk for something called a C. diff infection. So C. diff, or Clostridioides difficile, is a bacteria that's sometimes found in a healthy individual, but when you take a lot of antibiotics, it kills off that other healthy bacteria that keep it in check. So if someone has a C. diff infection, what to watch out for is like profuse watery like diarrhea, like up to like 10 times a day, loss of appetite, like fever, abdominal pain, like there can sometimes be blood in the stool. Those are some warning signs. It's important to know that you can't use Imodium, which is loperamide, like the over-the-counter anti-diarrheal for this, because it locks up the toxins in the gut. We usually treat it with fidaxomicin, which is Sufficit, or vancomycin. Next on my list is antacids with magnesium, like Maalox or Mylanta. Next on my list is metformin, or GLP-1 RAs like Ozempic and Mounjaro and Trulicity. Those are some common medications that can cause diarrhea and nausea and a bunch of cramping in general. Some serotonergic medications like dextromethorphan, which is a cough suppressant. It's found in Delsum and Robitussin. And then Trintellix and Vibrid, serotonin modulators, cause a lot of like nausea, diarrhea. I think Vibrid has a higher incidence of diarrhea over Trintellix. And then SSRIs like Zoloft. Next on my list is colchicine. It's used for the acute treatment of gout. And then I also have PrEP, like Truvada, or protease inhibitors for HIV, like nifilnavir. Mycophenolate, which is used for prevention of organ rejection and solid organ transplantation in combination with cyclosporin. And then another one on my list is acetylcholinesterase inhibitors like donepezil. It's used for the treatment of Alzheimer's. And then also important to note, rivastigmine is also in this drug class, but the patch has a lower incidence of GI side effects. Next on my list are chemotherapeutic agents like capecitabine, fluorouracil, methotrexate, which is used in a low dose weekly for rheumatoid arthritis and more severe psoriasis and psoriatic arthritis, and then some tyrosine kinase inhibitors like Gleevec. Another medication that's used for chemo is irinotecan. It has a lot of diarrhea with that. Another medication is metoclopramide. It's sometimes used for gastroparesis or nausea vomiting. And then last on my list, of course, laxatives.